Today, we're going to talk about something that's set to completely overhaul medicine as we know it. We're talking about a massive shift, all powered by AI, that could change everything from a simple doctor's visit to how we discover life-saving cures. So let's dive right in.
Get this number in your head, 10,000. That's the number of patients treated by AI doctors in just a few days. For human doctors to do that, it would take them at least 2 years. So the big question is, how on earth is that even possible?
Well, the answer is this incredible, almost science fiction concept called the Agent Hospital. It's a completely virtual world, and it's built to completely revolutionize how we train doctors, do medical research, and even how we care for patients.
Okay, so what is this place? This virtual hospital, which was developed by researchers at Tsinghua University, is filled entirely with intelligent AI agents. The doctors, the nurses, even the patients, they're all run by large language models. This means they can talk, they can think, and they can make decisions on their own. It allows for these amazingly complex simulations. I mean, we're not just talking about treating thousands of patients at once, but even modeling how a contagious disease could rip through an entire community. It's a really powerful peek into what's coming.
But, to really understand why something like the Agent Hospital is such a game changer, we first have to talk about a huge problem in healthcare today. A problem it's specifically designed to fix, and that problem is data silos.
So, what's a silo? Well, imagine this. Your doctor, your insurance company, and the local hospital all have their own separate files on you, and they hardly ever talk to each other. That's a silo. These closed-off systems chop up your health data into little pieces, making it super complicated to get a full picture of your health or to bring in new, better treatments.
And the difference is just night and day. On the left, you've got our current reality, a broken system full of roadblocks, and on the right, that's the goal. It's a connected ecosystem where all the data works together, getting access is simple, and the door is flung wide open for innovators.
So, the big question is, how do we get from here to there? The solution is to literally tear down these walls and build a truly connected healthcare ecosystem, a place where information can move freely and securely between every single part of the system. It really boils down to 3 major steps. First, you bring all the data together by giving every single person their own personal health cloud. Second, you create one software platform for everything. Think of it like an app store for health services that lives on your phone. And finally, you make sure the user interfaces all work the same, so that dealing with your health info is simple and totally seamless for everybody.
Now here's the really crucial point. This isn't just about doctors and patients anymore. A real ecosystem has to include everyone. We're talking about citizens managing their health all the time, not just when they're sick. It also includes insurance companies, the people who make medical devices, and tech companies, all working together on one open platform.
And when you connect all these different people and companies, the benefits are just enormous. They impact everything from big-picture health trends all the way down to you and your own experience as a patient.
And you know what? This is already starting to happen, in small ways. Just take this quote from Dr. Clifford Sturmer. He's actually using tools like ChatGPT to write letters to insurance companies, letters that even have scientific references, just to fight denials and get his patients the care they're supposed to have. He's using AI to battle the ridiculously complex system we have now, one denial at a time.
So, who wins when we start collaborating? Well, basically everyone. Patients get quicker and easier access to cutting-edge treatments, doctors get to spend way less time on that soul-crushing paperwork, innovators can actually get their new ideas to the people who need them, and insurers can share data and knowledge way more efficiently. When you replace all those fragments with collaboration, it's a win-win-win.
But building this new ecosystem isn't just a tech challenge, it's also a human one. It really makes us stop and ask, what kind of skills the healthcare professionals of the future, these smart talents, are going to need to not just survive, but to actually thrive and innovate in this brand new world?
So what are the challenges we haven't even thought of yet? In a world of AI doctors and perfectly connected health data, what new kinds of problems are going to pop up that the next generation will have to figure out?
And it's about more than just tech skills, right? How do other modern skills fit in? For instance, in a system that's flooded with data and AI-powered advice, how does something like media literacy, just the basic ability to tell good information from bad, suddenly become an essential skill for doctors and patients alike? And this all forces us to think about totally new types of skills. Things like AI ethics, data interpretation, maybe even virtual patient management. These could soon be table stakes. Figuring out what these skills are now is absolutely crucial if we're going to be ready for what's coming.
And that leaves us with this powerful and maybe a little intimidating thought. The tech takeover of healthcare isn't really a question of if, it's a question of when. The journey from these isolated, broken silos to an intelligent, connected ecosystem, well, it's already started. And it promises a future of medicine that's more efficient, more innovative, and believe it or not, probably more human.